Okay, I think we can start, and we can people will join as we go on. In fact, I've got a little anecdote that will take 1 minute to tell, so maybe we'll start with that, and a few others can join. Um, as many of you know, Ascend is a consortium, and I work for Crown Agents, which is part of that consortium. We've got offices in London. We're in lockdown in the UK at the moment, and I never thought I'd say this, but I'm actually missing going into the office in London. As part of my journey in, I get out at St Paul's Cathedral on the tube. And for those who don't know, it's this beautiful cathedral in central London with a big dome, and it's where Princess Charles and Lady Diana got married in the early 80s. Anyway, I heard a story about this just yesterday, actually, and I thought it was quite pertinent. So back in the day, a guy called Sir Christopher Wren was the architect, and he helped design and build St Paul's Cathedral. And he was a celebrity of his day, but clearly it's before social media, so no one knew what he looked like. So he liked to just wander down and see how the work was getting on. He went down to St Paul's Cathedral, and he saw three builders on a scaffold. One was hunched down, just chipping away at the block. The other guy was mixing some sand and water in to make the mortar, and another guy was sweeping alongside and picking up all the dust really purposefully with his chest puffed out. So Sir Christopher Wren went up to the first guy and said, "Oh, what are you doing here?" And the guy goes, "Oh, I'm just chipping blocks, so, you know, I need to feed my family." He went to the next guy. "So what's your role here?" "Oh, I have to make the mortar to ensure the wall sticks together." "Oh, you know, I need a job to feed my family." And he went to the third guy. "So what's your role here, good man?" And the guy goes, as he was sweeping, he stopped, leaned on his broom, looked at Sir Christopher Wren in the eye, chest puffed out with a gleam in his eye, and said, "Well, I'm helping Sir Christopher Wren make the world's most beautiful cathedral." And the story goes that this guy went on to become the team leader and worked with Christopher Wren in many other jobs. And you know, this struck me as something very pertinent to the NTD supply chain. I've only been working with NTDs for the last year or so, but and I know many of you have made careers working with NTDs and NTD supply chain. But that sense of purpose and that big picture thinking, and that real positive attitude, working together and looking just to complete a much bigger, achieve a bigger goal, is really something that I've noticed within the NTD community, specifically with the NTD supply chain. So it's something that, you know, I'm really happy and proud to be part of, although I've only been in within a year or so. So, you know, it's quite a great honour to work with everybody, many of you who are on this call. So I thought it was a nice little anecdote to start us off. Right, let's get going. So hi, good morning, good afternoon, and good evening, everybody around the world. I know we had registration from Sharad in Dhaka. I know TJ is over on the West Coast, so we've got people from all around the world. Thanks for joining our webinar. It's the first in hopefully a series of webinars from Ascend Lot 1, the supply chain team. So what we're going to talk about today and discuss is about improving downstream visibility in the NTD supply chain. We carried out a really interesting pilot in collaboration with Merck and Standard Co to improve data collection in a couple of counties in Kenya. There's actually an extension of the NT Deliver platform that already exists. We'll find, for those who don't know, we'll find out a bit more about it going forward. So, right, we're ready to get started. Let me find a way to move the slide. Okay, so we're all experts at Zoom and webinars and meetings online these days. Make sure your cat filters are off. So here we go. The webinar is being recorded. We're not going to post it on LinkedIn or social media or anything, but if anybody would like a copy of the webinar afterwards, please just drop us a line. I'll happily share it with you. I think you're automatically on mute. If you do have any questions, please type them into the chat function. We will save questions. We'll have enough time for a lengthy question and answer session at the end. And that will be led by our colleague Tina, who I'll introduce you to in a minute. Say hello on the chat if you haven't already. And if you've got any, just need a quick little bit of clarification, type it into the chat, and someone will be able to give you a quick answer. But the meat of the question and answer and discussions will save till the end. And also after the event, we'll share a 1 or 2 pager with an overview of the pertinent points. So without further ado, let me introduce myself. My name's Charlie Reeves. I'm supply chain lead for Ascend Lot 1, and I will be, I guess, host for this webinar today. But let's just have a quick fire introduction from the rest of the panelists today. So first of all, let's go to Kate.
Hi everybody, I am Kate Hargreaves. I am with Crown Agents and the team lead for Ascend Lot 1.
Thanks, Kate. And Johannes? Oh, you're on mute, Johannes.
Thank you, Charlie. Always good to unmute. I'm Johannes Holtz from Merck. I'm head of the Merck Schistosomiasis Elimination Program, and I'm also heavily involved in the Global Schisto Alliance.
Thanks, Johannes. And let's go over to the west coast of America, where we have TJ.
Good morning, everyone. My name is TJ Muehlman. I'm with Standard Co., and we're a technology partner to the NCD community.
Thanks, TJ. And then let's go over to Nairobi, where we have Benjamin.
Good morning, everyone. My name is Benjamin Ongeri. I'm also with Crown Agents. I'm a regional supply chain specialist based in the Nairobi regional hub. Thanks.
Thanks, Benjamin. And last, but by no means least, we have Tina.
Hello, everybody. Tina, based out of Nairobi as regional supply chain specialist, working with Benjamin on the Ascend team with Charlie. Thank you.
Thanks, Tina. Right, so here's a brief outline of what we're going to cover today. First of all, Kate will give us an overview of the Ascend program. I'll give a bit of overview of the supply chain strategy for Ascend Lot 1. Then we'll hand over to Johannes, who will give us some background on Merck's programs and why data and last mile downstream visibility is important to them. Then we'll hear from TJ and Benjamin about the pilot that we ran. We'll have a quick summary, and then we'll go open for questions and a discussion. So Kate, over to you.
Thank you, Charlie. And I loved your introduction, and I absolutely echo your sentiments. The global efforts and the global collaboration on NTDs is really inspiring. And in Lot 1, we are standing on the shoulders of giants in making the various improvements and adjustments to supply chains that we're going to talk about today. So thank you for that. So I'm just going to give a very little contextual background for those who are new to Ascend, covering the basic kind of what and why of Ascend. So the what is that Ascend is covering 5 of the most prevalent neglected tropical diseases through 3 types of health intervention. Firstly, morbidity management and disability prevention, such as operations to restore sight for those suffering from, for example, trachoma and lymphatic filariasis. Secondly, intensive disease management for visceral leishmaniasis. And finally, and most pertinently to today's collaboration, is the preventive chemotherapy that's provided via mass drug administration for LF, for trachoma, schisto, and onco. Next slide, please. Thank you. So why has this been set up? So UKAID has invested a flagship investment of over £200 million in 25 countries. Covers 2 lots. The first lot is the lot we're in today, so that's East and Central Southern Africa, South Asia, and led by Crown Agents with partnerships with APT Associates, the Royal Tropical Institute in Amsterdam, and Oriel Global Health. And the second lot is covering West and Central Africa, led by Sightsavers with Mott MacDonald, the SCI Foundation, and the Liverpool School of Tropical Medicine. In terms of what's different about Ascend, it marks a shift from supporting vertical disease programs towards a more horizontal program that enables learning and a more holistic approach. There's a strong emphasis on better integration of NTDs within mainstream universal healthcare, and this was well evidenced during 2020 by both lots of Ascend as we pivoted to supporting our partners in the Ministries of Health with the COVID response. Secondly, strong emphasis on system strengthening, recognising the growing appetite globally to support the national health systems that are needed to deliver NTD programmes, and to support the international impetus shared by WHO, USAID and other partners to support greater government ownership of NTD programmes. So just turning to lot 1, which is where the initiatives and supply chain improvements are being piloted. Next slide, please, Charlie. We're covering the following countries in East and Southern Africa and Asia. And next slide, please, Charlie. And for your reference, this table tells you the scope and the span of disease support that we're providing across those 11 countries. Back to you, Charlie.
Brilliant. Thanks ever so much, Kate, for that overview. So I'm going to talk now a bit about the Ascend Lot 1, the supply chain and the strategy, and kind of why having downstream visibility is important to us. It's not just something that we've plucked out of the air. There's a real background to it and strategic thinking. So I just wanted to explain that and give this background before we move on to speaking to Johannes and talking to TJ and Benjamin more about the pilot. So what I'm calling here is the House of Ascend. It will come clear in a minute what I'm talking about. So our program started with an inception phase, and in this inception phase, we carried out a series of supply chain assessments in all of our respective countries within the Ascend Lot 1. And each country clearly had its own nuances, was slightly different, has its pros and cons, but there were 6 clear cross-cutting themes within the supply chain assessments. And these are really the founding stones of our strategy. So parallel and fragmented supply chains, that was a common theme. There were no or very unregulated reverse logistics processes. There was no or very, very limited NTD specific LMIS systems. Distributions weren't integrated. They're often carried out on a very ad hoc basis, sometimes just chucking some boxes of pharmaceuticals onto a wagon that was going in that direction, quite literally. Supply chain integrity, also you could read that supply chain security was pretty weak in a number of countries, and the capacity and or the morale of staff was often questionable or quite low. So these founding stones really helped us develop the 4 key thematic pillars for our strategy: ownership and accountability, funding, think more like budgetary limitations, something like that, not necessarily just funding, processes and visibility. Each of the founding, the foundation stones links into one or normally more of those 4 thematic pillars. For example, if you take supply chain integrity, that's an issue of visibility. You know, you need to be able to understand where your stock is so things aren't leaking out onto the local market. Processes, weak processes mean create supply chain insecurities. If you're not managing your budgetary, or you don't have enough money to support your supply chains efficiently, then things can leak out. Supply chain integrity comes into question, and also it's a question of ownership and accountability. So if you look at each of the 6 foundation stones, they all link into 1 or 2 or more even of the thematic pillars. And then this is why I'm calling it the House of Ascend. You know, it builds into our supply chain strategy, and it's very clear. Well, it needs to be emphasized that we have a two-pronged strategy. We have your day-to-day operations. So that's the classic supply chain, getting the right goods in the right time at the right place in the right quality, etc. And then we have a longer-term advocacy kind of role. So so for items that are going to take a bit longer, that are part of the wider Ascend sustainability mandate and supporting health system strengthening, of which we hope this pilot and potential further rollout is one. Okay, so I think it's important to understand really what we understand by what is visibility. I mean, you know, you can look on Google, any supply chain textbooks, there are lots and lots of different definitions of it. Yeah, you know, and this is one which for me is fine. You know, it's not a hill I want to die on. We can debate this for long, exactly what the proper term is, but I think this is good enough. It's about timely access to actionable information from internal and external nodes of the supply chain. And I've highlighted there the 3 points which I think are really important. Timeliness is key. It's no good having access to information or data that is out of date. So you need timely access, something as relevant and real time as possible. Actionable information, not just data. I'll talk about this more in a second. Not just data, but information that you can act upon. And then also talking about internal and external nodes of the supply chain. Supply chains are all about relationships. It's a relationship ecosystem. So you just don't want your own data from within your own organization. It's about collaboration, being able to share data and information across the entire network of your supply chain. And then again, just emphasizing the data issue here. Like, data is a raw material, individual units with no specific meaning. It's only when that data is processed and organized that it collectively carries meaning. And then with that information, it can give you real excellent insight into your supply chain. And with that insight, you can take decisive actions. Okay, right, so just three points here. Why is downstream visibility important in the NTD supply chain? So first of all, having strong visibility, understanding the data and having good information coming from downstream, it can really drive supply chain efficiencies. That means essentially you can reduce waste. And then by reducing waste, it means you have more funds and more budgets to do something else with your extra funds. You can either produce more product and deliver that to other countries or to other programs, or with that extra money, you can use it to strengthen your supply chain. Having good downstream visibility also improves responsiveness. Now, responsiveness is the time-based function of agility, and it means you can react quickly to sudden, unanticipated changes in demand. And it also enhances your traceability, especially if we're talking about pharmaceuticals. You know, let's hope it never happens, but imagine if there's a product recall, you need to bring product back all the way down from the last mile. If you know exactly what batches are where, it's going to be a lot easier to follow up and just making a lot of phone calls and looking through old Excel records. So just understanding visibility. Some things I just want to emphasize. It's almost like the justification of why we've started this pilot. Visibility isn't, you don't just go and say, oh, I want to improve visibility. It's only a means to achieving a goal, and you really have to understand what you want. So for example, you might want to know how much you've got in stock, where it's being held, and the batch numbers. You know, a different operation might want to know speed of time to offload of a truck, number of trucks, stock turnover, you know, items like that. We didn't need to know that. It's really important that you know what your goal is. And you also need to find a solution that fits everybody's needs. You know, I'm not an particularly IT savvy guy. I can cope just about with using Zoom and logging onto the internet, but, and most people are better at that than me. But you've got to understand the needs of everybody along the supply chain so that they can use the system that you're going to implement. And not just about whether they're tech savvy, whether they have the appropriate assets to access what you're going to implementing, or whether they have access to internet 3G, if they have a laptop, if they have a scanner, if you need one, for example. If you don't think about these things, you're going to have a fancy solution for completely the wrong problem. Take, for example, you know, I want to go on a drive in rural, I don't know, rural South Sudan. Without understanding the environment in which I'm going, if I could put out a tender for a really fancy car, I might decide to get a really nice brand new low-rider Tesla. You know, that's not going to get me very far in South Sudan. How am I going to charge it? I'm going to phone up Tesla and say, oh, you need to put a diesel generator on the back. You need four-wheel drive, etc. So you really have to have the right product for your needs. You've also got to consider the human factor. As I've said, supply chain is a relationship ecosystem. It's not just about me sitting here in London. It's about everybody within the supply chain. And I've mentioned data needs context and interpretation. I'll give an example here. Benjamin, I hope I'm not stealing your thunder. It's not one of your points. But I know from the pilot we carried out, there was one sub-county had a nil return. And if you didn't understand the context, you'd think potentially there was no stock held there. However, what it turned out was the health workers were on strikes because they hadn't been paid. And then we eventually got the data back from them. And that also highlights that you shouldn't consider visibility, your visibility tool, as a separate individual function. It needs to be considered within the wider health system. Having a system as well encourages engagement. Remembering one of my thematic pillars, it's all about ownership and accountability. Encourages engagement from across all stakeholders at all levels of the supply chain. It's important to remember that just having some fancy software is not a silver bullet to solve all your supply chain ills. As I've just said, it needs to be considered in context with everything else. So I like this phrase, conscious collaboration. Having a tool that supports downstream visibility requires conscious collaboration amongst all the stakeholders within a trusted standard of information exchange, a trusted system that we can all use and are happy to use. And lo and behold, within the NTD supply chain, that already exists with NT Deliver. And for those who don't know about it already, it's going to be talked about a bit more by TJ very shortly. So what I want you to think about now, this is my last slide, about a pebble dropping into a pond and the concentric ripples that come out. So first of all, we have identified the challenge, the timeliness and accuracy of data coming from downstream levels of the supply chain, and we've developed a solution. With that solution, we carried out our pilot study, which is our proof of concept, and this is as far as we've got now. What we want to do today is showcase what we've done so far through great collaboration and support from TJ at Standard Co and Johannes and his team at Merck. But we've got potential to roll out, test and adjust, this product further. And this is one of the reasons we've called this webinar today. It'd be fantastic if anybody on the webinar would like to join us on this journey to try and roll out NT Deliver, the downstream element, further in other countries and with other diseases. And the idea is the next stage, and this not four circle, it should be there shouldn't be a clear edge, it goes on indefinitely, is to embed and integrate the system that we're using further downstream across countries, and so it's integrated within health systems across the Ascend network of countries. So that's all from me. So now I'm going to hand over to Johannes, who's going to give us some background into Merck and about data and downstream visibility. So Johannes, over to you.
Thank you very much, Charlie, and thank you for framing the issues so comprehensively. I like particularly your House of Ascend. Sounds very aristocratic, sort of House of Windsor type of thing. No, it's seriously, it's great work which you and colleagues have been have undertaken here over the last several months and a year plus. We are absolutely delighted to be part of that. So, and thank you, Charlie, for giving us the opportunity here today to give this audience, which is definitely an expert audience, a little bit of an insight. Number one, what Merck is doing in schistosomiasis, and secondly, why this project and this great collaborative project is really hugely important for us. Next slide, please. Let me give the context why we in Merck are involved in this. Most of you know that Merck is a key investor, and I put it like that, in schistosomiasis for quite a while. Our main objective is very clear. We want to contribute and be a key player in the ultimate elimination of schistosomiasis in accordance with what is now the 2030 roadmap. This is something which the company has very clearly committed to. Our provision or our contribution in the form of praziquantelins particularly is sort of there until the elimination of schistosomiasis has been achieved, no more, no less. We have been in Schisto for quite many years. As you can see from this slide, we started our partnership with WHO in 2007. Initially, we sort of committed to rather lower amounts of praziquantel, as you know, the gold standard in the treatment of schistosomiasis. But that was scaled up, and by 2012, when the London Declaration was passed and Merck signed up to this, the company committed to provide no less than 250 million tablets, or we always say up to 250 million tablets per annum for the treatment of primarily school-aged children. The reason being that school-aged children, number one, suffer the most. I'm not saying that adults don't, but it's the sort of also long-term benefit of praziquantel treatment, which school-aged children sort of take away in the best possible way. 250 million translates into 2.5 or the other way around. We, at that time, the thinking was 100 million school-age children need treatment. It needs about 2.5 tablets per child. That's why 250 million. Up to now, we have provided around 1.3. We're reaching 1.4 billion tablets and a sizable number of treatments of school-age children. This is 2 years ago, we were in the region of 90 million, and we are active altogether in around 47 countries. Next slide, please. As you can see in a moment, these are the sort of figures as they developed over the last several years. These are official WHO, the figures corresponded or communicated by WHO. If you click again, Charlie, please. I draw your attention to 2021. What is written here is 170 million. That was at the beginning of the year. And in the context of supply chain, that's why I put it here. It's important to know that what we know at the beginning of the year doesn't really correspond to what the year eventually ends up with. This is demand at the beginning of the year. We are struggling. Penny Smith is on the call to sort of even this out over the year on the one side. Penny, once again, great job with your initiative. We will eventually, as you can see from the next slide, please, reach much closer to the 250 million tablets at the end of the year. You can see this here in the last set of bar charts, where on the one side at the beginning of the year WHO forecasts, and at the end then what we delivered in that given year. Next slide, please. So the figures which you get from WHO are not always 100% reliable as far as the current status quo is concerned. You have here, and this is why I put it on or in this presentation, also the indication that we are really active in a sizable number of countries over the last 3 years, no less than 44. Altogether, I mentioned initially 47. So we cover really almost all of sub-Saharan Africa in any given year. And as you can see, our big customer, if I put it as flippantly as that, is no doubt and continues to be Nigeria, with the DRC as well as Ethiopia following suit, and Tanzania also being a really big recipient of the praziquantel which we deliver. So Nigeria cumulatively over these last 3 years, nearly 100 million tablets on its own. As we all know, the need for tablets is not subsiding, just on the contrary. We are now talking about including adults, absolutely essential if we want to reach elimination. And then we're talking about a different dimension being added to the school-age children treatment. And I'm afraid it won't be Merck on its own, which will be able to serve these additional age groups, i.e. adults, but we will need additional partners to reach our joint ultimate goal of elimination. Next slide, please. I talked enough about the numbers of the tablets. You can see here what is being reported to WHO. We get our figures, and that's where it gets now closer to what we're talking about here and today. Our data come largely from WHO. As far as the reports from countries are concerned in any given year, they are never quite complete. So you've see here in 2019, and sorry, we don't have the very latest figures of 2020 as yet, 29 out of 34 at that time recipient countries reported, which gives you an indication about the let's call it 100% reliability of the data we are working with. Treatment figures, coverage figures, that's more from the epidemiological side. Next slide, please. What we do in Schisto is, however, not, we at Merck is not limited to praziquantel deliveries. That is the biggest investment, that's the biggest sort of part of it. But we have developed over the years and in cooperation with our colleagues in the what we call Merck Global Health Institute, an integrated platform which moves us, hopefully, altogether closer to elimination of schistosomiasis. I put in here the Global Schisto Alliance as one element, which we sort of initiated more than 5 years ago, which is now the sort of key stakeholder platform for the Schisto community. But we also work on FGS. Many of you will know that the company invests heavily in the pediatric praziquantel formulation. We do additional drug discovery, invest in new diagnostic tests, gene editing for snails, and of course also education and behavior change interventions. So it's this integrated platform which we develop and sort of work on a daily basis in Merck to reach this ultimate goal of elimination. Next slide, please. So why then is coming back to the importance and the seminar or the webinar here today, the importance of the data visibility downstream for us. Why is that the case? You have here next, click please, Charlie. This is the various challenges. You've seen this slide or this graph several times. I must admit I've pinched it somewhere. I don't even know where from, so I couldn't source it. But it really shows very nicely the sort of upstream as well as downstream challenges in the NTD supply chain. These 3 bits which I circled here in red, this is really what we are talking about here and today, largely, but not only, because as TJ will come when he speaks, obviously the interconnection between upstream and downstream is absolutely crucial. Next slide, please. And click again, thank you. I've sort of listed here a couple of issues, and this is by no means complete, why the data visibility in the downstream part, in the last mile part of the supply chain is so important to us. And whether we talk about medicine storage, yes, the huge issue about inventory management, and not only at one level, but for us, obviously, and for most of us, at all 3 levels for ease of use. I put central, regional, local level. My alarm is running. I have to finish, Charlie. I'm being reminded by my alarm clock that my 10 minutes are up. The over-under stocking, the last mile logistics, the hugely important issue for us of reverse logistics, which is sort of at the moment still highlighted or sort of, let's say, made worse by the fact that we have very large bottles of 1,000 praziquantel tablets, i.e. reverse logistics of leftover tablets, hugely important to us. And of course, the reporting and record keeping at the end user level in so many respects, plus the treatment data, which we are not focusing on here today, but the interaction between the parasitological data on the one side and the, call it really, in this context, very simplified supply chain data is hugely important. And the two need to be interconnected and take the relevant part from each other. So this project, I hope that makes sense. As I said, it's not at all complete. There are many more elements. Charlie, you mentioned quite a few of them already. Why this project is hugely important for us. We had in the past, my colleague, I don't know whether Christian Schröter is online already, we had sort of worked on data visibility in the last mile in Kenya before. We had 3 years of a pilot project where we sort of captured batch numbers of our praziquantel tail at the end user level in cooperation with standard code. It's all sort of learning by doing, and what Ascend has now together with its partners, including ourselves, sort of done here is really taking the next step forward. Next slide, please, Charlie, if you click through. Thank you. The one thing which is so important for all of us to remember is that collaboration is at the heart of all our Schisto work, of all our NTD work. This is what we are sort of demonstrating here today with this project. Sorry, Charlie, 2 minutes over, but here we go. Collaboration, that's where I end.
Brilliant. Thanks ever so much, Johannes. That's really great insight. So let's now hand over to Benjamin and TJ. Benjamin, I think you're going first.
Thank you, Charlie. And yes, Johannes and Charlie, that you've gone before me. Clearly, collaboration is a key word. It's a big challenge that we're dealing with. It's been there for a long time. It's true that a lot has been done before to try and resolve it. This is just the next iteration in this process in order to get that continuous improvement to get to where we need to be in terms of data visibility at the last mile. So this program, or rather this project, when we went into it, we were really trying to tackle two key challenges. I think those have been said over and over, so I won't dwell on them too much. But those two key challenges cause a lot of delays in the supply chain. So countries need to put in joint requests for selected medicines, for PC, preventive chemotherapy medicines, and often inventory data is missing, perhaps because reverse logistics has not been completed, or it has been completed but the data is sitting in paper form, and just trying to transcribe the whole bundle of paper, it's a tedious exercise. And if that data is there, is reported, it's often out of date or inaccurate, such that countries end up receiving a short supply because what they reported almost 8 months ago when they're putting in their GRSM, the situation has changed. Perhaps the data was not very accurate and they reported that they had stock, but the stock was expiring, in a short time. So those are challenges that we're trying to see, how do we tackle them? As Ascend, when we came on board, we had to look at what is existing. And that's what Charlie has very well put, that there is a system, a global supply chain information system that has very good upstream data, very good transparency in that upstream supply chain, that every country will know what they have requested, they will know what stage the shipment is, and what eventually arrived in country. But after that, we get a blackout. So the NT Deliver system is basically trying to provide, that visibility at the first mile. It is a collaboration, and the supply chain forum, which really uses a lot of this data with these partners who are in that forum, really helps to provide, that coordination that is required at the higher level. What is missing is the last mile. And what you're trying to do is, fill that gap or bridge that gap. Next slide, please. So what is the end game of this tool that we came up with? Really, ultimately, we want to move away from paper-based and Excel inventory forms that need to be completed to some easily accessible web-based inventory dashboard that someone like Modeste, who's sitting at Espen in Brazzaville, will not need to send a form to a country and tell them, please complete this, so that they can see what is sitting where. But they will go to the system and say, PZQ or ivermectin for this county or for this country. Having several levels from the national level to the sub-national level, and saying what is sitting there, and drilling down and getting the batches that are sitting there, because we are linking the information that is in the upstream system with the downstream system. Next slide. Yeah, so I'll hand over to TJ over here to continue from there. Thanks.
Thank you, Benjamin. Good morning, everyone. I'd like to first kind of start by acknowledging a lot of the hard work that this team has done over the last several years in conjunction with Merck and NT Deliver to kind of set the ground stage for where we're at now with this tool. And that's the last mile project that Johannes referenced earlier. It's a lot of learnings, a lot of things that we've taken away from those projects to get us to where we're at today. So what I'm going to do over the next several slides is discuss basically how it works and how we deployed this, and the speed with which we deployed it, I think is also worth mentioning. So at its highest level, the way the tool works is it's a series of surveys that are conducted pre and post MDA activity. And the way those surveys are conducted, it's using sort of off-the-shelf tools. It's not something that the end user has to install on their computer or on their phone. It's all web-based. It's all derived from NT Deliver, which sort of provides a little bit of that comfort and familiarity that is required with deploying new tools. And so what happens at the beginning is this survey is distributed via WhatsApp and email. And that survey is then web-based, and it collects some basic indicators, which we'll talk about here in a moment. That data is then aggregated and displayed and deployed via a dashboard that is available on web and on browser. And this whole kind of continuum repeats itself before and after MDA to provide visibility into the activities and visibility in terms of accountability and in terms of inventory. Next slide, please. So what this basically does, just a little bit more information on this, we communicate with the district pharmacists at the county or sub-county level to collect basic information from them. We get those email addresses and WhatsApp information from the MOH. So we'll talk a bit about that here in a moment. And the survey that's deployed to them collects basic information like what medicine are we collecting information about. Right now it's praziquantel, but the system is configured to support all the PC and TD medicines. We've done in the past albendazole as well, and have talked about doing mebendazole. So we collect that data from them, what their medicine they're doing. We ask them what batch is this in relation to, and this is where NT Deliver really kicks in. So NT Deliver has a lot of information already in it about the first mile supply chain. So what medicines were sent to the country, what batches were those, what are their expiry dates. So we already know what batches are already in the country. We just don't necessarily know where they are in the country. And through this last mile inventory, we now know where those batches have been sent because we have an integration with KEMSA. So they send us that information. So instead of letting the end user type that in, they can pick what batch number is this related to. And then they tell us how many open or closed bottles they have. There's a few other questions that allow them to sort of provide feedback or ask questions, which was a critical feedback loop that maybe previously didn't exist or was sort of like a sneaker mail kind of thing. So this provided the ability to share information, but share that data in a very easy way to access that information via smartphone or desktop. One other thing to mention is that this data integrates with the expiry alarm, which is a slightly different subject, but is important to this conversation because the NT Deliver has a tool called the expiry alarm, which alerts donors, implementing partners, ESPN and MOH personnel that batches are going to expire that have been sent to the country. So now this tool allows us to plug into that expiry alarm and mark batches that have been used. So this kind of, again, continues connecting the upstream data with the downstream data. Next slide. I think this next slide is probably one of the more kind of critical or crucial components to this whole thing. It's the dashboard that provides the data to the partners, to the Ministry of Health, to WHO, and donors. And for the first time in my 7 years working in NTDs and 5 working in NTD Supply Chain Forum, this is the first time I've seen a real-time or a near real-time holistic dashboard of the entire supply chain for a drug and for a country. So what this dashboard provides is data from ESPN. So we have an integration with ESPN. If for those unfamiliar with the ESPN platform, it provides data around the JRF and JRSM. So that data then feeds into this. So we know how many drugs were requested. We know how many people were treated in the past. It pulls in data from NT Deliver, which shows the purchase order request from Kenya. So we see how much they asked for, and we see how much WHO sort of issued to them. We see data from KEMSA, which is the distribution within the country, the supply chain authority in Kenya. So once the medicines get to Kenya, get to the port, then KEMSA is responsible for distributing those medicines. So we have that data. And then last but not least, we see the sub-district inventory. So this kind of is the last piece of the puzzle of, well, once those medicines get to the sub-county or district level, how many are used and how many are left over. So this dashboard paints a really critical picture of what is happening, where are the medicines, how many are left over, and you know, to all the points that Johannes and Benjamin have made. Now that we have this data, how can we act on that data? What can we do with the data? So that's a big component to all of this. Next slide, please. So overall, just a handful of things to kind of take away with how this went. Flexible and rapidly deployable. One thing that I'm particularly impressed with is the speed with which we deployed this. You know, obviously 2020 was a very dynamic year, to say the least. We were in the middle of a pandemic, but we were, from the moment we started talking to Benjamin, Tina, and Charlie at Crown Agents, to the moment we actually deployed this was about 4 months. And really only about 6 weeks of configuration and data gathering and kind of figuring out what we're going to build. So all in all, 4 months to build something in the middle of a pandemic across 3 continents and 11 time zones. 5 a.m. wake-up calls are common for me now. Now that we were able to do that so quickly and I think so effectively, I think we've set the ground level for deploying this to other countries even more expediently than we've already done. The flexibility, because we're using a survey tool, we can customize the survey and change the kinds of questions we ask. I think that's a really critical piece as well. We learned, again, a lot from previous surveys and previous studies about what it takes to scale this to other countries. You know, I think in Kenya, we were able to, in previous projects, use SMS and short code, and we learned that that isn't as deployable to other countries, depending on infrastructure. And the way we're doing it now requires just basic internet access, not even always on internet access, just periodic internet access or 3G coverage, which we'll talk about here in a moment. Just the ability to kind of periodically connect to the internet to send data is all that is needed. And again, the web-based surveys work on old smartphones, new smartphones, desktops, so on and so forth. So we learned a lot about what kind of infrastructure is required and what we needed. We made data real-time available to MOH and partners, and this was a very, I think there were some components of this that were pleasant surprises. And for example, we found that the MOH became reliant on the reporting aspects of the tool about who reported and when, and that was not, we added that component just sort of as a giveaway, not really thinking about that they would use it so actively to account for who had reported and who had not. So that real-time data was really critical in providing that data both to the ministry as well as to Crown agents and other partners. The ability to integrate with global, regional, and national systems. You know, one thing that we're very clear on is that this tool is designed not to replace other tools. If countries have other systems, we're not seeking to replace them, we want to supplement them. So if there's not an inventory tool in place, then we think this is a good solution. But if there's already one in place, then we simply want to integrate with that to provide visibility to NT-Deliver, to ESPN, to other systems, that this data is critical. And I'll give this quick anecdote. I did a quick analysis of the inventory stock that was reported in the JRSM. So for those unfamiliar, the JRSM reports the stock that is on hand, and a little over 50% of the countries had not reported stock. So that's, they don't report anything. And then you know, the other ones, as Benjamin alluded to, the data is a little bit out of sync in terms of time. So this tool that we have allows us to kind of skip over that time delay and provide an easy to use tool to get the data into these different systems. And I already mentioned the accountability. Again, the accountability is really crucial in terms of providing partners and MOH personnel insight into who has reported and who has not. And that's a really critical component to all of this. Next slide. So some considerations in terms of what does scale up look like. First, you know, what we really need is the ability for MOH and program leadership to provide contact details for the people who are distributing the medicines, whether that's the pharmacists or NTD focal persons in districts. But all we need is an email address and a phone number. With that, we can communicate with the people at the subnational level. Getting those contact details is a critical component to all this. And it also provides the MOH and the program leadership with the contact information for those people for other means. So it's sort of it gives you benefits on both sides. As I've already mentioned, respondents must have access to a computer with internet connectivity or a smartphone with at least 3G coverage. And I want to emphasize that this is not a survey that is happening every single day or even every single week or month. It is going to be a periodic thing. So it's not something that they need access to all the time. It just needs the access to supply the information when the surveys are conducted. Having somebody on the ground is a really important part of this. Obviously, I'm a technical partner in all of this, but I'm also based on the West Coast in the U.S. So I'm not on the ground, although I've done a number of field visits and seen and been able to interact and understand what's happening. I can't do much from here. So having somebody on the ground has proven to be incredibly useful in both in terms of collecting some of the contact information, understanding what the data needs are, and understanding how to utilize the data. Again, our role here is to provide clean, useful data that the people on the ground can then actually act upon. So that is a critical piece of this. And then last but not least, as we're all familiar in the NTD world, IU and districts always change. So that's the number, that's the names. So understanding these names and districts and being able to report that data back to the regional and global systems is important. And I will say kudos to ESPN. They have a really rich set of data around IUs and districts that we utilize for this tool, and it proved to be very, very useful and very, very helpful. And so But these are all things to consider in terms of scaling up. And in my opinion, you know, having done, we do a lot of last mile data collection. This particular project has, I think, the highest degree of success, or a high likelihood of success in being deployed to other countries, just because we've learned a lot over the last 3 or 4 years. This is not something we just started doing the other day, and the ability to deploy this to other countries is something we look forward to doing. Thank you.
Fab. Many thanks, TJ and Benjamin and Johannes and Kate. Let's just a very quick summary, and then we can open up to questions and have a discussion if anyone has any burning desire to. So look, we're at the start of a really positive journey here. We, as I said previously, we're really keen to expand and roll out this platform in other countries and across other diseases. So please join us on this journey. It'd be great to have you on board. And a few points to emphasize. Collaboration, transparency, trust are central, really central tenets of successful supply chain. And as TJ emphasized there, the system that we're using is complementary to existing systems, if they do indeed exist. And it's a great opportunity. It's not a threat to these systems. We're not planning to rip out and replace systems that are already there. Clearly, the platform extends the reach of the system NT Deliver that already exists. So it will provide end-to-end visibility all the way from the manufacturer all the way down to the patient at the very last mile. And I'm not sure if there's many systems that really provide that end-to-end supply chain visibility. And as I've emphasized, it can really increase responsiveness, drive supply chain efficiencies. Really great for strong supply chain excellence. And again, just to emphasize, visibility shouldn't be considered in isolation. It's part of the wider health system strengthening mandate. And we always have to consider the human element. We can't just dump a new system, fancy, shiny design onto a project and then rub our hands and be done and dusted with it. It's all part, you have to consider everyone within the supply chain. So with that brief summary, I think we can open the floor to questions. So I'll hand over to Tina, who's been monitoring the chat group over the past hour or so that we've been speaking. And Tina, over to you.
Great. Thank you, Charlie, and thank you everybody for the presentations. It's really interesting to hear it again and again and re-emphasize what we've been doing. I've been following the chat, and there have been a couple of questions. We've got a number from Alex Pavluk from Site Savers. So maybe Alex will just give you the floor and you can re-emphasize your questions. You've talked about availability of the assessment. I mean, it wasn't an assessment, it was an exercise we were conducting in real time pre and post MDA. Your second questions were also around the fit of the new tool or this process into the current state data. So I'll give you the floor to just talk to us for a couple of minutes. Alex, is Alex still with us? Oh,
he's saying he doesn't know how to unmute. Tina,
yeah.
unmute him.
Let me try. I can't do it, I think.
Anna.
Anna?
Oh, I think I have the floor.
Yes.
Yes.
Okay. All right. Yeah, so thank you so much for giving me the opportunity to ask a few questions. Really great presentation. It's great to see people are focusing on this. And you hit on a lot of really important points. TJ, in your presentation, you mentioned the fact that the JRSM data tend to have missing remaining stock information on the drug package summary tab. It's sometimes reported in the summaries, but not in the drug package. Can you talk a little bit about how the, maybe 2 points. One, about how challenging it was to get an integration with KEMSA. I think that's really a critical point. I'm glad you mentioned it, and it really does speak to your commitment to extending existing systems. So if you could talk a little bit about how you were able to build that relationship and integration. And then maybe the next thing, to talk about how this system fits into the current state data flow. You know, as you know, when you introduce a new tool, you're either just adding something brand new, or you're running in parallel to something that's already happening. So maybe you could talk about how it fits into the current state, and if it's used for anything beyond supervision, if it's used for reporting or others. Thank you.
Yeah. That's a great question, and I'll defer the reporting one to Benjamin, I think, and Tina. They might have more insight into that, but I can address the first 2 points. So KEMSA has been a partner since we started our first last mile journey with Merck about 3 or 4 years ago. And I will say, I'll give them much credit, because they are definitely interested in providing visibility. They're interested in helping provide the data upstream so that other systems can kind of get visibility into that. But the reason that we were able to pull that off was the on the ground personnel. You know, if I had simply asked for it myself, there's a pretty good chance they would have just simply ignored me. But by having feet on the ground to build those relationships and sort of make the introductions and to make the business case for why this was important, that was a critical component to all this. And I think we were able to show that this data was going to be used for integration purposes only, and to kind of highlight the data again more upstream to these other systems, and they were willing and accommodating partners in that. I think on a technical note, NT-Deliver and ESPN both are systems designed with integration in mind, which kind of leads to your second point of parallel systems. Parallel systems, as a technical person, is the thing that makes me you know, wake up in the middle of the night with a cold sweat. I hate the idea of parallel systems, because it's a waste of resources and a waste of time. So at every opportunity we have, what we're always aiming to do is to either utilize a system that's already in place, or provide a system when there's a gap. And here there's a very clear gap in data. So way we designed the system is that the data would be captured via the inventory tool, flow into NT-Deliver to provide visibility to partners and donors, but also flow potentially down the road into ESPN and other systems, you know, back to the country as well, to provide the data gap to those systems as well. And I think what you see then at that point is again, really providing a single tool that kind of marries a lot of systems together. And so that's the ultimate goal. I can say, you know, when we designed it, we certainly had in mind that this data would hydrate the JRSM, the inventory components in the JRSM. That's our intention, or the JRF, and that's what we're planning to do. I'll kind of defer to Benjamin and Tina as to how it's being used for reporting at the moment. You're on mute.
Benjamin, you're on mute. Anna, can you help?
Yeah, we have a look, 1 second.
Okay, go ahead, Benjamin. We're still on mute.
Can you hear me?
Muted me, I think.
Ah, yes,
Okay.
now we hear you, yes.
Yeah, speaker issues, Zoom issues, I can't understand. Yeah, so thanks for those questions, Alex, and definitely TJ has given a very good response in terms of the integration aspects. And what I can see is that, as noted in the presentation, ultimately, we would like that data is not captured twice at any stage. So we see that even where there are some country systems in place, perhaps, there is a form that is required to be filled in with the supply chain data, inventory data, and someone really almost has to go into that form, an Excel form, and post each line for each IU, for each medicine. So really, we ultimately think that this should be replaced by an online database where information has been entered right from the IU and it becomes available to everyone along the chain, and you don't really need to fill a second form. So yeah, it's not just supervision, but replacing the current reporting forms. That's the future. That's where you should be going. And the trust, or the main motivation for this is just the transparency that's already existing within the NTD supply chain, and really getting that trust and collaboration across, from the first mile all the way to the last mile. And we think already countries are sharing this information, but in a very tedious manner. And any way we can do to simplify that, will go a long way. And as TJ has mentioned, there's nothing very fancy about this tool. It is basically a series of surveys. It's a survey tool that you can deploy when it's required to do it. And the ease with which you can deploy that and get the data from the IUs is what makes it really a tool that can easily be scaled to any other place. Of course, we need to look at infrastructure challenges in places like South Sudan, of course, where mobile penetration perhaps has not reached, and we recognize that and say perhaps it will grow with the way any country's infrastructure grows. So there are countries that are ready to do this. There are countries that may be ready to do this in a year or 2 or 3. So that's where we are with this. Thank you.
Great, thank you, Benjamin. And if I may be allowed to just complement what Benjamin has just said, Alex, we basically started with relationship building between the NTD program and central medical stores. We realized that they were not sharing this information, and I think just having a joint webinar, going through challenges, issues, they were able to connect. And going through countries where the logistic management systems in the central medical stores is very well established, I think this data was very easily available for TJ to receive it and plug it into this platform, simply because they have an ERP system. They have a very well-established distribution mechanism in place, and we were able to work with Kenya quite quickly on this. And what it did for the NTD program manager was it facilitated her downward communication at the sub-county and county level. So she was quite engaged in reviewing the output from the sub-counties. She was calling us to ask us, why hasn't this county responded? Tell us how many sub-counties have already responded. So the level of inquiries or engagement from the focal person at the program for planning the MDA enhanced because they were able to see this information. So I hope it helps concretize some of your questions. So thank you very much for your questions. Alex, the next question, there was one question we had from Jack Riley. You were asking about the root causes of the challenges, and Kate, thank you very much for responding. You already kind of provided some answer. You mentioned that there's poor data management, but Jack, would you like to say something else? Or are you happy with the answer that was provided?
Hi Tina, and hi everyone. Thank you again for the opportunity to talk. Yeah, the question I had was with regards to what the root causes for the problem. So for example, if it is data management is one of the root causes, it's just trying to understand, is it the data not being managed because of roles and responsibilities? Is it capacity, capability? And it's just trying to understand whether that's really fixing the right problem. And then I guess the second question, leading on from some of the work that we've been talking about today, is if we are finding out that the new system which has been developed and the pilot that you're running is being managed successfully, if we're managing to receive more data through that tool, what feedback mechanisms have we got with the other solutions that we've got previously? So the JRSM files and so on. Are we building that feedback loop in to try and help make those additional systems easier to use?
Hi, Tina, let me attempt to answer that question. Thank you, Jack Riley, for that question. Yeah, so I would think that the root of the problem, it's multiple. As Charlie has mentioned severally, the human factors involved are quite a number. But essentially, when it comes to the availability and accessibility of the data, I think it's just a tedious process of just trying to, I like to paint a picture of perhaps an MDA that has happened in, 50 IUs, 100 IUs in places like Ethiopia. And then each of those is sending pieces of information to a central person to try and capture it, perhaps in an Excel spreadsheet. They may send their own Excel spreadsheet. Someone has to kind of pull the information from that one into another one. And that alone is such a tedious and error-prone process that makes it difficult for these countries, I guess, to respond, in a timely manner to a lot of these requests for inventory. And if we could actually collect the information at source in electronic format, I think we'd be going a long way to solving this problem. Of course, there are other issues around capacity, as you said. In some countries, the NTD supply chain is completely parallel, such that it doesn't flow, medicines don't flow the same way that the other health products flow. And therefore, you cannot rely, for example, on district pharmacists who are very well versed on the medicine supply chain to provide that information. So Kenya, at least on this side, we knew that the district pharmacists are involved in the process, and it makes it much easier. In some countries, the NTD coordinator, is the one who is relied on for everything, and they are almost always overwhelmed around an MDA time because they're managing multiple responsibilities and coordinating so many activities. So those challenges, of course, will not be solved by this tool, but the availability of the tool and the ease with which it can be deployed means that we're beginning to chip at the edges of the problem, and perhaps with time, these other things begin to fall in place. So yeah, I hope I've answered that question. Thanks.
And I can jump in, Jack, and answer the question about the JRSM. I can say, without hesitation, that one goal is to make the population of those joint application package forms as easy as possible through a variety of tools. I think mostly through the ESPN portal. But this tool is 100% designed in the long run to populate those kinds of forms. Hopefully that will be the case. So there's not a technical limitation there. And we'll see when or how that will become a reality. But that'll be sort of a question for Modest and his team, to kind of help figure out how to get that deployed. But yeah, technically we could do that.
Great, thank you, Benjamin, and then TJ. And
now, if I may just
about Modest. Sorry, go ahead, Johannes.
Tina, just to add one thing, and this is maybe a softer element of the whole thing. Let's not forget, I think what Jack is raising is a hugely important question, but let's not forget that a tool like that also instills and brings in a new culture of accountability. If you make data available, if you make this transparent and visible, there's a different set of responsibility, or a different sense of responsibility which develops. And that in itself is a beneficial cycle, as it were, which will ease and solve some of the problems, at least, which we are all encountering at the moment. So it's not the ultimate solution, but it's a hugely important step forward to instill this culture of accountability and responsibility in a different way. Thank you.
Nice conclusion, Johannes. Thank you so much. Jack, I hope that that is satisfactorily responding to your question.
Yes, that's great. Thank you. Thank you all.
Welcome. And we had a couple of comments and a question from Modeste from WHO Afro. Thank you very much, Modeste. You talked about basic stock tracking tools, which are essential. And there is a lack of stock data visibility. And because you kind of front face that challenge, when you receive JRSM forms, which you have to review as part of the JAP application, you actually have asked a question about the financial implication of this tool. So again, Benjamin or Charlie, would you like to take that question?
Yeah, sure. Let me start, and then Benjamin might want to add a little bit. I'm not going to start giving numbers over this webinar now. That's probably commercially sensitive. But as I understand it, the initial setup, there's pretty much a set fee. It probably varies from country to country. And then there's an ongoing monthly cost for the fee, which is for the licensing, I believe, which is not too burdensome. Benjamin?
Yeah, I think you basically said it. That's the way the project, I believe the monthly data cost is related to, the background software to manage the database for the country. But yeah, it's, I think, a fairly small fee. I think TJ can shed some light. But yeah, the initial setup to set up the administrative levels in a country, I think TJ was mentioning the region of 6,000 to 10,000, which needs to be incurred. But we look at it as something that is done once because the tool is already available. And then going forward, this is not something that needs to be, have personnel on the ground who are paid to support the system all the time. So there are quite a number of cost advantages if you look at it that way. Thank you.
Thank you, Benjamin. And Modeste, I'll just complement the HR requirement part of your question. As you saw, basically, there was not much that was needed in the pilot. TJ developed, in collaboration with Benjamin, developed and rolled out the survey. The focal point who was preparing the MDA and managing the MDA was in touch regularly with Benjamin and myself. We had weekly updates and calls, but once the data was submitted, it was pretty real time. So it was just a matter of making sure that the contact persons who had to be reached out for the survey were correctly indicated, and the focal point manager at the entity program also made direct contact. So it was all integrated into the actual activity that needed to be done. So there was no additional staff that was recruited to handle this pilot. I hope that helps answer your questions. Modeste, do you have anything else you'd like to tell us? You can take a minute or so to talk to us.
Hello, thank you, Tina and the team. I think this is a very good opportunity to help improve the last mile supply chain data visibility. We know we all struggle to have this. This is a critical component for supply chain efficiency. And having it pilot in Kenya, I think it's a good exercise. And as we are seeing the result, I think it's a start to see if we can extend it to other I don't know if countries or countries, but something that is showing result, we really encourage and we appreciate. And this is the reason why we always try to work together with available partners in the country to make this last mile supply chain more visible to everyone's partners, funders, and the government, and also try to build country capacities in having these supply chain visibility, because it helped them as well in terms of making decision, supply planning, etc., and partners, discussions, etc. Thank you. I have nothing more to add.
Great, thank you, Modest. And so I think I don't see any more questions on the chat platform. So maybe we have a good number of participants. Can I just invite Ian to give us just a small comment on what we've discussed so far?
1 second.
Tina,
Yes.
sorry, there's some hands up. Maybe we could.
Oh, okay.
Yeah.
I don't see them.
Oh, okay.
Yeah. Okay.
I see Penny's hand is up. Maybe if you can unmute her.
Yes.
Yeah.
Okay.
Yes,
Sorry,
thank
Penny.
you. No worries. Thank you. I've got to step off in about 10 minutes. Thank you for this really helpful and comprehensive presentation. It's been, TJ and I have talked a couple of times about these opportunities. And one of the things that we keep coming back to is about cost. So Benjamin, I kind of just want to follow up on something you just said about the sustainability aspect of the ongoing fees. I think you were saying it would not be an issue for the countries, but maybe I misunderstood what you were saying. Can you speak a little bit more about the planning for the long term of who will absorb those ongoing monthly costs? Is Ascend planning to manage that for, indefinitely, or is it something that you've discussed at the country level that they would be able to absorb? This has been a real concern for us about long-term sustainability. As USAID, we don't want to dive into something that the country wouldn't be able to take on long-term. So just wanted to know if you could speak to that a little bit more.
Sorry, just unmuting myself. So thanks for the question. I think what we are seeing here is that we have a system, at least at the global level, that seems to be working. It's providing information to a lot of partners, and all the partners are appreciating it. So extending that system to the country level we've tried this proof of concept, we've seen it can work. And what we're trying to see is, can we get all these partners who are involved in all these processes and all these successful upstream processes to come in and then, get this thing working at the country level, because ultimately all of us are benefiting. So, Ascend is here. When we are here, we can do the pilot in 1 or 2 countries, get it working, but invite other partners who are able to, get their countries also working. And ultimately, the countries will pick up the tab from, where, if we've proved that this is working very well. Of course, as the partners are here and are able to support, they will continue to support that, because we think that, these things, we start from 1 year to another, and we struggle to get countries allocating budgets for this. We know that
Right.
always happens, and we can't wait. We start getting things done, and with time, it's not a heavy investment that countries may not be able to take it up, but the partners may not be able to support in the short term. So we feel that strongly this is something that partners can help support countries at least in the next 1 to 2 to 3 years.
Right.
Thank you.
Right. No, thank you. I appreciate that. That's something that we wrestle with as to whether or not it's something we should be budgeting with our partners and with other partners collaboratively, and at what point do you have that conversation at the country level with the ministry to say, we're showing the benefit, this is clearly benefiting your country, when and how can you take this on yourselves financially? It's a difficult question for sure.
Yeah.
Yeah, great point, Penny. And I think we still have work to do. We are basically also trying to do exactly that. Speak with the head of the national program here in Kenya, show him the results, show him the process, and we want to also roll this out in 2 other countries. We've got MDAs ongoing. Zambia is one. Malawi is also going to be conducting MDAs. So we will be able to incorporate much larger outputs from this pilot, and we'll be able to engage with the programs on how they feel and how they also benefit from the actions. So thank you, Penny. We still have a number of participants.
Tina,
Yes.
I think Johannes wants to come in.
Just sorry, not to delay proceedings. Just to emphasize, I mean, this is collaboration, and of course, countries need to take it up. But at the same time, and I don't want to appear too sort of pompous about this, but we, as the donor of the medicines, will also be more demanding on countries to take the whole last mile issue up in a different way than it has been in the past. We need more efficiency and effectiveness of the use of the tablets. And we can't have sort of tablets being wasted. And this is one step going in this direction. And I think Tiana, who is online, will agree to that. We as tablet providers will have our role to play to convince countries that this is the way forward: transparency, improvement, and accountability in the use of tablets.
Thank you very much, Johannes. And I was also looking for Tiana. I was actually going to ask her to make a comment. I don't see her online. She might have had to drop out. But I actually wanted to move to the other pharma donors. I can see Taka is online. Please help me with identifying if anybody else is online. But Taka, what do you think about what we've done? And please share your thoughts with us. Taka, I think you're on mute. Would you like to share any thoughts with us?
Tina, I think Tina, I think we're now on the hour and a half, so I think perhaps we should close it. Did you say that Ian? I can't see the chats. I think maybe want to hand over to Ian to close for us.
Yeah.
A few words. Thanks.
Okay. Okay, that's great. So thank you. Over to you, Ian.
Great. No, thank you very much to everybody who's made these fantastic presentations and generated so much thought and discussion. I think I obviously represent a company that's more involved from the epidemiology side of things. And, when we talk so handsomely about achieving elimination, we're only ever going to get there if we have good quality supply chains. And the issue of having supply chains which are not only visible, nationally owned, but also better managed is going to allow us to achieve these elimination objectives in a more timely way. So I really feel that the level of effort that's been committed to this to unpack the issues which are faced within the supply chain and come with solutions to improve the management thereof and the ownership of national government is only to the credit of everything, including mostly the epidemiology. I'd just like to say that to this point, as a group, I think we've enjoyed the very best of partnership and collaboration. Only this morning, I was on a phone call with Johannes, having had a phone call from Charlie, to then phone Benjamin and Tina to bring us all together on a particular issue. And we need to continue that style of work where we're all pulling together. So on that, I think, thank you to everyone. Thank you to the presenters. And I'm going to go full circle with the analogy of St. Paul's Cathedral, and say every great cathedral needs a good choir. So we've all got to be singing from the same hymn sheet. So thank you very much, everybody. This has been great.
Thank you very much, Ian. And just as a last small comment, I'd just like to invite Nat to just give us 1 or 2 words for this afternoon. Thank you, Ian. Nat, would you like to say something? You're unmuted. Oh, Charlie, I think Nat is having IT issues.
Okay, so shall we? We'll close it there then. I think it's a shame we can't hear from Nat, but never mind. Thanks, Ian, for your closing words, and we'll just close it there. If you want a copy of this recorded webinar, just drop me a line, and I'll happily share it, or share it automatically with all attendees. And we'll also write up a 1 or 2 page on the key themes discussed. Thanks ever so much, everyone, for joining. I really look forward to continued collaboration going forward. So that's all from now. Cheerio. Bye.